Good afternoon, Professor.
Afternoon. Thank you.
Hi, Dr. Bukhari.
Hi, Dr. Saeed. How are you doing?
Good, good. How are you?
Good, good. Thank you. Thanks for joining. We are waiting for more people to join and we'll start.
Sure, no problem. Yeah, I just joined earlier to make sure that there is no issue for that.
Perfect. Thanks so much.
You're welcome.
Professor? Hello.
Good afternoon, everyone. Can you hear me?
Yes. Yes.
We can hear.
Perfect. Thank you.
Yeah, I can hear you, Professor.
Thank you. So welcome to the CCPS Healthcare Informatics webinar series. Those who don't know me, my name is Ahmed Bukhari. I'm faculty in College of Professional Study in the divisions of Computer Science, Mathematics, and Science. So for today's webinars, we have the topic Privacy Preserving Protocols on Health Informatics. And I'm honored to introduce you Professor Saeed Samit. Professor Saeed Samit is an associate professor in the University of Windsor. He did his PhD in computer science from University of Ottawa. Afterwards, he went for his postdoctoral fellowship at the eHealth Information Lab at the Children's Hospital Eastern Ontario Research Institute. He joined University of Windsor in 2012, and with his research interest, activities are privacy preserving and security aspects of various applications, especially in the healthcare sectors and health informatics. Thank you so much, Professor Saeed Samit, for your time. Over to you.
Thank you very much. Hello, everyone. Good afternoon. So you can hear me now?
Yes, I can hear you. You can share
Yes, we can hear you.
Also, you can share.
So yes, one moment, please. I share my screen. So hope everyone can see my screen.
Yes, we can.
Okay, good. Hello again and good afternoon, everyone. First, I should thank Dr. Bukhari and Dr. Keshkar for inviting me to have this talk at your Health Informatics webinar. So because Dr. Bukhari already introduced me, so I just skip the bio for myself, and then I go to start the talk. As you see, the topic of my talk is privacy preserving protocols for health informatics. So the very first thing that comes to our
sorry to disturb you. The window next to your slide, if you can please just minimize that window, then we can see your slide window. Yeah, maybe
you need this one.
Oh yeah, can you reduce?
Good.
More? Yeah.
Yeah,
it's more visible now. Yeah, it's more visible now. Yep.
Okay. Yeah, I just had that whiteboard in case that I need to write something, so I can make it bigger later on if needed.
Thanks.
You're welcome. Thank you for letting me know. Yeah, the very first thing that comes to our mind is why privacy. So that would be a good idea to start talking a little bit about that. So the very first question comes to our mind is why do we need privacy, or simply why privacy matters to us? I'm sure that many of you have already watched and listened to the TED Talk by one of the journalists in this and some related aspects named Glenn Greenwald. And in his talk, he mentioned that some people believe, or actually they make believe that, quote, there is no real harm comes from mass surveillance because only people who are engaged in bad acts have a reason to want to hide and to care about their privacy, and end of the quote. However, you know that this belief will actually divide us to good and bad people. And bad people are those that, like, for example, terrorists or theft, that will actually privacy matters to them. But good people have nothing to hide from government, business, anyone. Which is, I believe, and I hope that many of you as well, totally wrong. And this is not the case in reality. And for more examples, for example, in 2009, the CEO of Google at that time was Eric Schmidt, and he actually said, quote, if you are doing something that you don't want other people to know, maybe you shouldn't doing that in the first place. And again, of course, it is very obvious that him or people like him actually do not believe what they are saying. And also, you might hear that a very famous guy said, quote, privacy is no longer a social norm. I'm sure that most of you know who said that. Yes, it is from Mark Zuckerberg, the Facebook guy. And if you see their homes, their lives, you see that they put lots of guards to make their own things private. So this means that they don't actually not believe what they say. So let's see some numbers in terms of privacy. This quote is from IBM that in 2019, every day we create more than 2.5 quintillion, which is actually 2.5 exabytes of data every day. And the most interesting thing is that 90% of this huge amount of data only created in the last 2 years. And even if we go to the most recent information, we will see that actually in 2021, this amount will raise to around 1.14 utabyte, which is around 1 million times of the amount that we had for 2019. This means that data brings many things, including money, and in general, data is nowadays actually power. Therefore, during the last 2 decades, we are facing with a very fast-growing rate of data privacy breaches because of the value that data comes to us. And in different fields, doesn't matter, it could be in health, in government, in business, in every sector. And this will make data protection and preserving data privacy very important. And that's why we have a huge amount of incidences of privacy breaches in different sectors. Let's see some examples and numbers. For instance, some very famous data breaches during the last couple of years. You remember Yahoo. They had more than 3 billion records of data breaches in 13 and 14. And another one, for example, Fast American Financial Corporation in 2019, they had around 1 billion records, data breaches, and many, many other examples. And based on the statistic, actually data suggests that cybercrimes cost businesses more than $2 trillion in only 2019. And 80% are increase in the number of people that are affected from health data breaches. That's why health data breaches is one of the very most important aspects of privacy preserving issues. So therefore, to show the importance of privacy preserving in health sector, this is not bad to see the per record data breach cost in every sector. For example, you see in technology, we have about $127 in average, but if you compare it with $363 for healthcare, you will see that how much important for health data breaches. That's why not bad to see some numbers for the 10 biggest healthcare data breaches of 2019. For example, AMCA, or American Medical Collection Agency, had 25 million patients data breaches in 2019, or Dominion National, around 3 million patient records. And these are some information from 2019. And even I can talk a little bit about the numbers that are coming out recently. For example, by the end of 2020, the security breaches cost more than $6 trillion for only healthcare companies. Or for instance, 1.5 million records were breached only in around 40 companies in healthcare systems, only in 1 month in February 2020. And ransomware nowadays, ransomware attacks were expected to quadruple between the last 4 years, from 17 to now. And between 60 to 80% of data breaches go unreported. You remember, for example, the incidents for the Yahoo in 2013 and 14. This means that health privacy is very important. This is only some information about US. Means that 1 in 4 consumers had their healthcare data stolen, and 1 in 2 breaches resulted to identity theft. And you know the cost for that in different aspects. And you see that more than $6 million is only the average total cost of only a single data breach. And 50% of healthcare organizations, even recently, they didn't have any deployment or of security automation in their system. And one of the very important things is actually more than 70% of all data breaches recently, for example, in 2019, was caused by healthcare providers. Means that more than outside attackers, we have inside intentional or unintentional attackers to the data privacy. This means that healthcare data privacy is very important nowadays. Just before going to some information for that, I just want to give you 2 examples, and then we go forward. One of the examples in healthcare system is the problem of disclosing data to different public health units for example, disease surveillance. You know that healthcare providers need to actually have to report different type of diseases. For example, nowadays, you know the problem of the recent pandemics during the last 1.5 years for COVID-19. The healthcare providers need to report different type of diseases, especially pandemics, to public health authorities. And actually, even we have privacy acts in US or in Canada or in many developed countries, like in US HIPAA, in Canada PIPEDA, that actually we don't need the consent of the patients to provide this information by the health providers for different purposes to the public health unit. However, on the other side, healthcare providers are actually caring about confidentiality, and not only confidentiality of the patient, they are also concerned about confidentiality of their own. Means that because of different purposes like reputation or other purposes, they are actually reluctant to disclose their patient data even to the public health unit. And we know that public health unit to make decision to have different health policies and different important aspect, they need to have this type of access. This is one of the problems that later on we will talk about, one protocol that I had in this area. And the other example is the problem of adverse drug reaction. You know that nowadays many people use more than one or more medicine in their daily life. And one of the very popular problems that we have is adverse drug reaction because of different type of hazards that are linked with various medicines. There are many patients that are sensitive to different type of drugs that they use. And of course, because of these, we have different type of negative reaction that they use based on their prescription. And therefore, because of that, the pharmaceutical companies have some very strong policies and procedures for investigation of drug safety before sending the drugs to the market. However, this type of detection and this type of drug safety procedures are not adequate enough. Why? Because we need to know the actual effect, actual negative effect of these drugs when they are inside the market and when they are used by different patients. Therefore, a pharmacovigilance science came to the fact and they have this type of investigation after usage of these medicines by the patient. And because of this science, we need to somehow pull the data from healthcare professionals, from hospitals, from clinics, to be able to do different type of statistical analysis, like logistic regression, survival analysis, to find different type of possible adverse drug reaction. These are just two examples that why we need privacy in health sector and in healthcare systems. Now it is better to talk about some formal definition and preliminary about security and privacy before going forward. To just make it very brief, we know that security and privacy are somehow different. However, people use these together with the same meaning, but actually security is actually some tools and techniques that we use to protect and keep the data confidential, integrated, and available. However, privacy is dealing with individuals, and it is actually the right of the individuals to how to control, collect, and use the data, how to share the data with each other, with their health professionals, and how they disclose the information to for different purposes. And based on that, we have actually two general approaches for preserving the privacy of data. The very first approach is doing data anonymization. Means that by different type of anonymization technique, like randomization or other things, we just try to anonymize data before releasing for different reasons, like research or policy making, etc. For example, the tables that you see in this slide actually shows the K-anonymity, which is one of the techniques that used for data anonymization. However, we know that it is not enough. That's why we have more type of techniques that come on top of K-anonymization, like L-diversity and T-closeness. However, at the end of the day, we do not have a complete protection of the data. If we just want to categorize the data anonymization, we can categorize them to randomization, data swapping, or some type of de-identification. For example, we can add noise to data, additive or multiplicative noise to the data. However, we know that we lose the accuracy, or we can just swap the information among the records. Again, we lose the utility as well as the accuracy of the data. Or we can just have some type of integration or suppression of the data. And again, at the end of the day, for any type of data anonymization, we reduce the accuracy of the data and also reduce the level of the utility of the data. And also there is a high chance of data re-identification to disclose the data. The bad thing is that we don't have a definite measurement or metric for measuring the level of security when we apply this type of data anonymization. That's why another technique comes to the fact, which is secure multi-party computation. Before going to that, we know that if we use data randomization and other techniques of anonymization of data, the main trade-off is actually between the privacy and accuracy. It means that if we want to bring up the level of the privacy, then we have no choice to have low accuracy at the end of the day for providing the knowledge to the data users. However, this trade-off is different for secure multi-party computation. In secure multi-party computation, we usually use some type of mathematical operation as well as some cryptography techniques. We will see some details later on, but in general, the advantage is that actually we can prevent some disadvantages of data anonymization. For example, we bring the level of re-identification risk down, and also we do not suffer from low accuracy and utility, as well as because of these advantages, we have higher response by the data owners because they sure that the data is highly protected. However, there are some obvious disadvantages, like because they have extra computation, they apply cryptography techniques or extra mathematical operation to keep the data private. Therefore, the performance in terms of time as well as memory is lower compared to data anonymization. And of course, another implicit disadvantage or difficulty is that for every single method, for every single standard algorithm, we need to have different type of privacy preserving protocols. And that's why the main trade-off for secure multi-party computation is between privacy and efficiency. Means that if we want to bring up the level of the data privacy, we have no choice to have the efficiency decrease because we need to apply more cryptography tools with a larger key and more mathematical operation. That's why many people are working on the hybrid systems to include both approaches in their protocols. There are some other aspects, including the configuration of the data. Sometimes data is configured by the client server, means that we have one server as the that is located in one place, and then we have some data owners or data users as client. And also nowadays we have distributed data, means that data is not only centralized in one place. For example, different hospitals have their own records of their patient, means that actually the data is horizontally partitioned among different hospitals in one region. Or sometimes every party has a portion of every record. That's why we say vertically partitioned data. And other parameters like the behavior of the parties that are involved. For example, we have sometimes we are lucky and we have some honest parties that they correctly follow the protocol and they don't misuse the intermediate data. Sometimes we are dealing with semi-honest people that although they follow the protocols correctly, but they might use the intermediate results from the other parties. And unfortunately, sometimes we are dealing with malicious parties. We might see some examples later on. And also, because data is usually distributed among different parties, sometimes we are dealing with only two parties, and sometimes we are dealing with multi-party. And why it is important? Because if we, for example, adopt the secure multi-party approach, then the protocols for two-party and multi-party would be different. And also the type of the network, as I mentioned, client-server, peer-to-peer, or third-party involved. And finally, the result, the final knowledge, sometimes is distributed and partially owned by the parties, and sometimes every party will receive the final knowledge from the protocol. These were some preliminary in terms of security and the privacy preserving approaches. During the last couple of years, I tried to actually adopt the second approach, which is secure multi-party computation. So my work is on that aspect of privacy preserving protocol. And because of that, for every algorithm in data mining and machine learning or health statistical method, we need to do different type of mathematical operation. Therefore, to make them simple, first we need to have some secure building block for the fundamental and simple mathematical operation. For example, assume that we just want to add up some numbers that are private and kept by different parties. Just assume that 10 people are in a room, and each people has their own age, and they do not want to share their age to other people. Nowadays, it is a private information. However, for some reason, they want to know actually what would be the average age of all the people in that room. This means that at the beginning, we have some private input, And at the end, we want to have some aggregated knowledge. And in this case, we want to have just secure average or secure mean of these people's age. Now, of course, if we do not have any concern about privacy, they can easily share their age and compute the average by one person and share it with other. However, if we assume that the data or the age is private and they are not allowed or they are not willing to share with each other, therefore, we need to have some privacy preserving protocol. For instance, I guess many of you already saw this protocol that provided by some computer scientists in this area. So we can easily assume that one of them as the initial person, like the lady on the left, and she considered a random private number in here, for example, r equal to 6. She adds up the number with her own private information and send it to the second party. Second party do the same, just add up with their own information and send it to the next one. And we do that until we reach to the last party, and last party will send the final result to the first one. And now you can realize how we can compute average. The first party just reduce the random noise from that and compute the average and broadcast the average to all the people. In this way, none of the people knows about the other people's age, but at the end of the day, everyone knows the average. Of course, in the first look, it's good, right? It seems that it is private. However, I guess you can realize that we might have some possible issues. One of the very popular issues is compromising of two or more parties together. Just assume in here, the second and fourth party just compromise, and the second party send this value, which is 20, not only to the third party, just to the fourth as well. And then this lady, using her own information received from this lady and the information from the second person, will realize the private information of the third person. That's why this is one of the possible issues by compromising of two or more parties. Another possible issue is that, as you remember, we said that the behavior of the agents are different. If we have one or more malicious people in this protocol, then, for example, one person can maliciously consider a wrong private information, and at the end of the day, the only person that has the correct average is the one that is malicious, and the rest of the people receive the wrong average or information or knowledge. However, for every issue, we might have one or more solutions. For example, for the first issue, we can get rid of that by some type of data segmentation. For example, instead of one round, we can have multi-round, say K round, means that every party, every person can divide the private information to K number of private information, and they run the same protocol K round. Therefore, even two or more parties compromise, they are not able to reach to the other people's individual information. Or some computer scientists already provided some good protocol to get rid of some type of malicious behavior. So this was just a very simple example that how we can use some mathematical operation to apply on a given standard algorithm, for example, computing the average of some numbers, to make sure that at the end we have a privacy preserving protocol, or actually privacy preserving or secure building block. Later on, we can use this building block in other algorithm. If you remember, I mentioned that the secure multi-party computation uses not only mathematical operation, but also some cryptographic techniques. One of the cryptography techniques that is used is homomorphic encryption. In homomorphic encryption, we are able to map one operation between the ciphertext to another operation between the plaintext. And public key crypto system is actually good candidate for that. And one of the good homomorphic encryptions is Payer crypto system. Of course, it is not fully homomorphic encryption. And unfortunately, we do not have a practical fully homomorphic encryption yet, although is proposed by Gentry in IBM, but it is not still practical. However, we can use this type of partial homomorphic encryption to apply to have some secure computation. For instance, if we use this Payer crypto system, we can have a secure two-party multiplication to convert the multiplication of two private input to the addition of some private output. But I don't go to the detail, but if, for example, Alice and Bob have two private outputs, by using the Payer crypto system and exchanging some encrypted information at the end, each of them has their own private data such that we can convert multiplication to summation. Now you might ask, okay, what would be the application of such building block? Of course, one of the very good applications is secure dot product. Actually, secure dot product has been proposed by one of the computer scientists named Gottal. And if you consider two private vectors, one x belongs to one party and vector y belongs to another party, they can use the secure multi-party computation to convert the dot product to actually the summation of two single numbers. Means that I can convert x1 times x2. So I can easily convert x1 times x2, times y1 equal to, for example, u1 plus v1. And same thing for everything. Therefore, the dot product would be u1 plus u2 plus un plus v1 plus vn. And this one belongs to one party, this one belongs to another party. Therefore, we were able to convert a dot product to the summation of two single private outputs. And this is actually very useful building block that we can use in many standard data mining and machine learning protocols. And because of the limitation of the time, I don't go to the details, but these are the list of some of the secure building blocks that we can use. For example, I have a protocol for secure comparison. Without releasing the data, we can say which data is smaller or which data is bigger. Or for example, we want to know the intersection of two sets without revealing the sets to each other. Or for example, for the matrix operation, later on we will see that for the logistic regression, we need to have secure matrix operation. Therefore, I had some secure building blocks for, say, secure matrix multiplication or computing the inverse of matrix summation. And of course, some people in computer science, they provided, like Dr. Pincus, provided a very famous algorithm, secure algorithm for Oblivious polynomial evaluation. Means that one person has a polynomial, another person has a single value. And this one wants to know the evaluation of the polynomial using his own value. And we name it a secure polynomial evaluation. And actually, Pincus used this for classification method. So therefore, the very first thing is to provide some secure building block, and my first job was to provide that. And then after providing those secure building blocks, I started working on some privacy-preserving protocols for health informatics. The very first one that I worked was privacy-preserving data mining for classification. And in classification, you know that one of the techniques is decision tree. And in decision tree, we can have decision tree model with different techniques. One of them is using information gain that is provided by Pintas. I use Gini algorithm for providing the decision tree model. And in Gini, as you know, we have the fraction of the sum squared, summation squared divided by summation squared. And by using the secure building block that I had for multiplication and addition, I converted this very complicated formula. And in each part, for example, the sigma of xi1 means that x11 belongs to first party and xk1 belongs to the k party. And I converted the summation to the multiplication. And finally, I convert the fraction to the multiplication of two single values for two parties. Therefore, without revealing the individual informations from the records belong to each party, they can create and compute the Gini formula and finally create the classification model. Of course, we have some application for decision tree. For example, if you want to provide telehealth services, or for example, in here, if you want to have some type of decision for health insurance premiums by considering attributes like age, a smoking habit, and some health conditions, you can create a classification decision tree model by using the privacy preserving decision tree. Another algorithm that I worked was for privacy preserving clustering. Again, in health informatics, we have many applications for clustering, like identify of the cost change for different patients and patterns. And also, for example, discovering disease subtypes and stages. We need to have some type of clustering techniques. And this is actually the visualization of a clustering result. And as you know, inside the clustering methods, one of the popular ones is k-means. And inside that, iteratively, we need to create the centroid of every cluster. And if we have the data shared by different parties and they are not allowed to share their information, every time that we want to compute centroid, they need to compute the summation of their information divided by the number of information inside that cluster. And again, I use the multiplication and addition protocol to convert the formula of computing centroid to just the multiplication of some private output. And by having that, we proposed a secure clustering method for vertically partitioned data. When each party has a subset of every record from the whole data. The next protocol that I had was on association rule mining. Again, for a healthcare system, for example, if you want to find some associations between different statuses of diabetics patients, therefore, you need to have applying association rule mining protocol. And you know that for association rule mining, we need to apply the a priori algorithm. And inside this algorithm, every time we need to compute support and confidence. And inside the support, we need to compute some multi-party computation in here, addition and division for different stages. And you know that at the end of the day, if the data is vertically partitioned, For example, we can say every person has this disease or not. Therefore, we are dealing with binary vectors. Suppose V1 is one binary vector belongs to, say, n patient, and V2 the same and V3 the same. And at the end of the day, we want to compute the product of these binary vectors. However, these vectors are private information. Therefore, I provided a secure binary dot product using the regular dot product and some adding privacy because the information is only 1 and 0 to find the cardinality of the set intersection. Means that at the end of the day, we know in how many records we have the intersection or we have the value 1. And then by that, we apply that on association rule mining for a priori algorithm. Then the next work was the one that I briefly mentioned at the beginning as a sample of healthcare consideration for privacy. I mentioned about the secure disease surveillance, and we mentioned that healthcare providers are reluctant to provide this information to public health unit. Therefore, we need to have a privacy preserving technique. So the regular non-secure way is that we have health professionals in one side and public health unit on the other side. And they are not able to send and receive individual information to each other. Therefore, we add some roles, including key generator, key holder, and aggregator, such that first, the key generator using the Paleo crypto system provided a set of public key and private key. And actually, we use the threshold crypto system to make sure that no single person is able to decrypt the information. In here, each health professional using the public key will create the encryption of the information and send it to the aggregator, partially sent to different aggregators. The bigger the number of aggregators, the more the private of the final protocol. That's why we need to take care about the efficiency. And then every aggregator will do the partial operation and send it to key holder. And because we use the threshold crypto system for Paleo, first of all, every key holder is not able to decrypt the whole data. However, they can decrypt partially and send to the mixer that is owned by the public health unit. And they can finally have the unencrypted information, which is the integrated information for every region for having different type of policy decision. The next protocol that we touched was about secure linking. You know that in every region, we have different registries. For example, we have registries for vaccines, for different tests, and even for some type of demographic information. And we know that vaccines reduce the cost associated with screening and treatment, and also the rate of morbidity and mortality. And on the other side, we know that the long-term and overall effectiveness are usually unknown. And the reason is that we do not have connection between different registries in different regions. For example, provinces in Canada or states in US. And therefore, we need to have some type of linking between this information. Therefore, we provided privacy preserving protocols that applied by different registries, and they securely send the information to the public health unit for different type of decision. For example, we have two registries. One of them is demographic information registry, and the other one is a location that is doing different type of tests on HPV associated disease. And then none of them are able to just send the individual information to the public health unit. and they want to apply, for example, chi-square test, or odds ratio, or relative risk. And you know that when we want to compute this information without considering the privacy, we are dealing with zero or small values in different cells. For example, in this table, you will see that Aboriginal ethnicity have negative tests for HPV, only one person, and of course it is identifiable, which is not private. Or even in here, we have 0 people for negative HPV. Again, it shows some extra information that reveals some privacy issues. And even if we just want to suppress the information, then the accuracy is gone. We don't have the utility of this type of suppressed information. Therefore, we need to have the actual information. However, each registry, instead of sending the whole information to the public health unit, they apply the crypto system, and they apply the partial crypto system on the data and send the encrypted data to the public health unit. And public health unit can only access to the final unencrypted integrated information to have the final result for the odds ratio table or chi-square test and other statistical methods. At the beginning, public health unit will send the query to different registries, and then every registry dealing with one or more aggregators, they apply the cryptographic hash and commutative method to apply on their own data and send the information to aggregator. Aggregator will send this encrypted information to other registries. They apply the same but different keys on the cryptography system and send back to the aggregator. An aggregator will do the aggregation and send the partial statistic information to the public health unit, and public health unit can mix it to reach to the final result for odds ratio, chi-square, or relative risk. And remember, I mentioned about the adverse drug reaction. I don't go to the detail, but remember we said that we need to apply logistic regression and survival analysis. Again, we are not able to get the information, the raw information, from every health professional. Therefore, every health professional has their own information, and we apply the logistic regression. And you know that in logistic regression, we are dealing with matrix operation. And actually, in the matrix operation, we are dealing with computing the inverse of summation. And just assume that every information belongs to one party and they are not allowed to share with each other. So the protocol that we provided was able to convert the complex system of inverse of the summation of the matrix to just convert it to the summation of the private matrices. Each one belongs to one party. In here, L1 is the private input belongs to the first party, and M1 again is the private output to the second party. However, we are not allowed and we are not able to compute this information because we have the computation of the inverse applied on the summation of all the information, but we convert it to the separate matrices belong to different parties, and they can share it with the third party to compute the final result of logistic regression. After that, we realized that we actually need a privacy preserving framework because we have some good privacy preserving algorithms and protocols. Why not bring them all in one place as a privacy preserving framework to apply and use in different applications? The advantages is that first of all, it is a unified and integrated system. It is a web-based one, and also we are able to apply a hybrid approach, including anonymization and multi-party computation. And also we can play with the trade-off between efficiency, accuracy, and privacy. Therefore, we provided, first of all, we provided a standalone system. Then we converted to a web-based system such that users are able to apply on a web. And these are just some performance. For example, if they want to apply logistic regression on 100,000 records, they need to have about 35 seconds to apply a privacy-preserving logistic regression for adverse drug reaction. Because of the shortage of the time, I just need to summarize that. I have some work on health informatics using a mobile app. One of them is for a personal health record that we propose a privacy-preserving protocol for PHR system such that every person is able to send their own information to their health professionals, and whenever they want to, they can revoke their access to the health professionals in terms of changing and different situation. And the other one, which was very important, is the continuous authentication. Means that if you are having a health application on your mobile and your mobile is controlled by someone else by different incident, then the continuous authentication behind the scene will check the user behavior, and if the user behavior is different from the actual owner, the health application will be automatically locked out and prevent any misuse of the system. I don't go to the detail of them. If you are interested, I can share the presentation for each of them later on with you. But the current and future things that I'm working on that, first of all, we are working on using blockchain for different privacy-preserving statistical analysis method like standard deviation, skewness, and linear and logistic regression. We applied a permissioned blockchain, and the reason why for using blockchain is that first of all it is secure, and the second thing is that it is interoperable, which is a very important concern by the health professionals. This is one of the things that we provided for EMR systems, and as the other works that we are working on the usage of blockchain for federated learning. And you know that in federated learning, 2 or more parties are actually creating a distributed model for different type of data mining and machine learning systems. I guess I do not have enough time. Just I go to the acknowledgement to indicate the companies and organizations that supported me for my research, and also the students that if they were not, I was not able to do none of these works. And I guess I should leave the rest of the time for any possible question. And sorry if it takes long.
Thank you so much. It's a very, very informative session. I learned a lot personally. So with that, we can go with the question answering session. So guys, if you have any question, you can just turn on your mic or you can type and ask question to our speaker. In fact, I have one question here in the chat. Uzair is saying, can you please mention some research challenges involved in privacy of e-health records?
Yes, actually, one of the very important challenges that I did not mention in here, and actually many people just reluctant to mention, is that finding some actual data. Because you know that I was in Memorial University, and I was working at the Faculty of Medicine, and you know that we had a hospital and lots of data, And even myself, as a faculty member over there, I was not allowed to directly access to the health data of the patients because of the Privacy Act. So one of the big challenges is getting ethical approval and finding direct access to health records. And even at the end of the day, when you get those records, they are anonymized, and you have no access to the individual data, which is good for the patients, for the people, and sometimes it makes difficulty for you as a big challenge. And of course, depending on the approach that you are using, for example, if you use anonymization, of course, accuracy is one challenge. If you use multi-party computation or cryptography techniques, you have the challenge of efficiency. And nowadays, actually, one of the works that I didn't have time to go through that, I'm working on big data, privacy preserving on big data. For example, you know that we can use k-means for clustering for regular data when we have, say, 10,000, 100,000, or even 1 million records. But how about 100 million or 1 billion records? Then you need to switch to big data analytics. And you know that k-means, we have a complete different algorithms for big data. Actually, one of the courses that I teach is mining massive data set. And in that, I teach the new algorithms for clustering, for classification, for neural network, for different machine learning and data mining techniques when we are dealing with big data. And still we have many remaining techniques that we need to have privacy preserving protocols for them. These are just some challenges dealing with big data, accessing to real data, performance issue. These are the things. And for example, if you want to adopt blockchain, one of the things that I did not mention in here, for example, is dealing with scalability. As you see in here, I say blockchain scalability. This is another challenge if you want to adopt blockchain in terms of using in health application.
Thank you so much. Any other question? We have a room for
yes. Someone asked, is any state-of-the-art approach of federated learning that support privacy? Actually, one of my PhD students right now is working on federated learning, but by using blockchain. There are some work that are existing for federated learning, means that they privately create models in a distributed way. Means that during the intermediate stage, each party has their own partial model, and at the end of the day, without revealing the intermediate models, they have the final model. There are many works that are already done, but for the blockchain, we are still in the infancy of this aspect for federated learning.
Wonderful. Any other question? So I have a question. You
Yes,
see
sure.
that like, with the blockchain, the last part that you mentioned. So how would it solve the scalability issue? I mean, at this time, the biggest problem, even with the clinical decision support system, even with the EHR, that it's a silo. You know, in the hospitals, every hospital now have, at least in the US, some sort of EHR or EHR system, but the hospitals are not very interlinked, and we cannot really, get insights and can get the aggregated data and can use machine learning, deep learning algorithms, like till we have the aggregated kind of data, like this data of New York State comparing with the Massachusetts, and how the blockchaining would help that the issue. And when the second to that, like the is not make the overall process slow. I mean, when you have to go for ciphering, deciphering, so how it would work?
Yeah, actually, first of all, I should mention that blockchain has its own features. First of all, it is distributed and it is secure, and you can program the smart contracts. And also, you know that the transactions are immutable and transparent. So it gives some advantages if you use blockchain in health application. For example, it is secure and it is distributed, and it might help some type of interoperability issues. And also it is immutable, means that you cannot change it. However, at the same time, it has some challenges. For example, immutability, as it has advantage and also disadvantage. For example, European countries, they are somehow reluctant to use blockchain because of actually the records are immutable. And based on their privacy acts, they are not able to completely use and adopt blockchain in their own protocols for health application. And actually the thing that you mentioned in terms of scalability, although blockchain has advantage, but it has its own scalability issue. For example, actually two of my students, master students, are working on scalability of the blockchain protocols. And you know that in blockchain, we have one of the most important part of the blockchain technology is consensus algorithm. And you know, for consensus, the usual way is not scalable. Means that for every block or every transaction that you want to add, you need the consensus from all the parties involved in the blockchain. And this means that the regular way is not scalable. However, there are some works on improving the scalability. For example, my student is working on finding a subset of the blocks that, first of all, they are much smaller than the whole number of blocks. And second of all, based on the history, they are trustable, that we can only use their consensus instead of having consensus from all the blocks. And therefore, we can increase the scalability of blockchain. However, this is only one simple solution. We have some other people, I don't have anyone on top of my mind, but they are working on different aspects of scalability of blockchain. But yes, we have this challenge if we want to adopt that.
Okay, excellent.
Answer your question properly or not?
Yeah, pretty much. It was very, very explanatory. Thank you so much. We are running out of time. So with that, we thanks our speaker on behalf of CCPS, College of Professional Studies, and CTL, College of our Department for Teaching and Learning. And well, thank you so much. And with the permissions of speaker, I will try to share the slides, and as well as, if possible, our recording.
Thank you very much,
for
Dr.
joining,
Bukhari.
and thank you, our speaker. And I will
Thank
see
you, Dr. Samit.
Thank you very much, Dr. Keshkar. Nice
Thanks.
to meet you virtually.
Nice to meet you too. Thank you.
Thank you.
All right, and
Thank
I
you
will
for your
see
time.
Thank you very much.
for the
You're
for the
welcome.
next webinar.
Thank you very much.
Thanks. Bye. Thank you very
Bye,
much.
everyone. Thank you.
Bye.